In psychological assessment, we need to differentiate formal and informal assessment practices. We of course can conduct an interview so that we can find out more information from someone about, for example, their mental health status. So I might ask them about their background, what kinds of difficulties they've been experiencing and how they've been feeling. However, there may also be a need for more formal kinds of assessments. For example, in order to actually use a medical and psychiatric terminology to diagnose someone with what we call depression and to evaluate the severity of that, there are specific symptoms that a person experiences. And we might need a more formal, systematic set of procedures to determine how severe a depressive episode is, rather than just taking a best guess. Now, there are important components of this definition. Systematic implies that we're consistent and thorough in our assessments to try and get the best measure of functioning. The best measure of functioning, of aptitudes, of abilities, and of mental states. So at the end of semester, for example, I'm going to decide who will pass or fail on the basis of, say, 5 questions taken from across all the lectures, tutorials, and textbook. Now, if I was in a lecture right now, I'd probably hear the groans of discontent. This was just a little example though. Obviously, for a formal assessment, we need to put the assessment through some rigorous tests itself to see whether it's doing the job it's actually meant to do. In other words, we need to assess the assessment or test the test. And we do this through 3 major ways. Through ensuring that it's reliable, ensuring that it's valid, and that it's standardized. And I'll go through these in more detail now.